Good morning, everyone, and welcome. Thank you so much for joining us today for this event on CSO-Led accountability mechanisms for budget advocacy. In addition to our esteemed panel, we have a lot of experts with us from around the world, and we want this to be a really informal conversation today, learning from each other. My name is Vandana Shah, and I am the Vice President of Health System Strengthening at the Global Health Advocacy Incubator, or GHAI as we call it. GHAI works around the world in over 60 countries, partnering with civil society organizations to support policy and budget advocacy campaigns. We believe that improving healthcare at scale depends on changing policies and expanding budgets, and by building advocacy capacity at the national and local level. Our emphasis has always been on locally led advocacy. So all of the work that we do is really working with local CSOs, local organizations. My portfolio at the incubator, which consists of a lot of different programs around health system strengthening, has a huge emphasis on health financing. Our experience with budget advocacy comes from all of our work on communicable disease and also non-communicable disease, which sort of expands the breadth of immunization, civil registration, prevent epidemics, tobacco control, drowning prevention, and you will get glimpses of some of this work. We have a brochure, I don't know if there are many left, which is on our approach to budget advocacy led by civil society, which is outside, or you can download a PDF about this. So it talks about the breadth of the work and our approach and how we do this work across the world. This morning, we'll speak about a topic that sort of goes to the next step from increasing budgets. This is how do you spend the budget accountably? For someone who's worked as a budget advocate on the ground for the last 20 years, I always say that increasing budgets is only 30% of the work. The hardest part is when you're actually trying to make sure that every dollar is spent accountably. And in some ways, my favorite example comes from Bangladesh, one of my earliest victories where we had managed to get a 1% surcharge imposed on tobacco products. And that took me a two-year campaign working with civil society partners from across the spectrum, across the country, and then became a 5-year journey, actually getting a single dollar from that surcharge, which was to be used for health promotion, NCDs, and tobacco control, actually utilized based on sort of putting the systems and the checks and balances in place. So today we're going to hear from multiple perspectives, government, multilateral, civil society, about how important it is not just to increase budgets, because lives are not saved by just increasing budgets, but really by making sure that every dollar is spent accountably and actually reaches the last mile. So I just want to emphasize that if you want to post on social media about this event, and please do, you can use the hashtags Global Health Advocacy and WHA77. There's a lot of people joining us online, and this event is being simultaneously interpreted in French and Spanish. Please press the button for the appropriate language at the bottom of the screen. It is now my distinct pleasure to invite our president, Yolanda Richardson, who is here with us today, to deliver opening remarks before we hear from our esteemed panel. Yolanda.
Good morning, everyone. It's a pleasure to be here and to welcome you to today's event. And thank you very much, Vandana and the team for organizing today's conversation and discussion. As Vandana indicated, at the Global Health Advocacy Incubator, we believe that public health advocacy is a critical tool to achieve improved health outcomes. And we believe that it's important as a result of that to track and making sure that there are resources available to actually implement the outcomes that we are all trying to achieve. And we do that with our local partners. We advocate for public budgets because money is how things get done. Appropriate budgets are the foundation for sustainable, equitable, and effective country-owned health systems. So we work with our partners on the ground to achieve additional resources for health. But budgets are not just a matter of money. Budgets set priorities. Budgets influence who has access to resources and who does not. And so that's what we're here to talk about today, how to use public health advocacy, and specifically budget advocacy, to assure accountability so that once resources are in fact allocated for health, that they are used in the way that they're meant to, they benefit the communities most in need, and that we're able to move forward to achieve the kind of health outcomes we all are collectively committed to. We want to make sure that there's transparency, and we want to make sure that there's timely use of those resources. One of the stories we often hear from ministries of finance is that once they even allocate the budgets, they don't get spent, that the ministries of health don't move the budgets quickly enough and the resources sit there. So we want to make sure that we're continuing to support ministers of health to get the resources to the places that are most needed and to the communities that are most impacted. So as civil society, we play a very critical role. And in that role, we ensure that once the budgets are allocated, that we track those budgets and to make sure that they are going to the places that are most needed. So we look and track the process from beginning to end, and then we also help governments and our partners to ensure that even once resources are allocated and they're used effectively, that that is a sustainable source of revenue, that it is not just one-off, it's just not completely tied to the annual budget cycles, but becomes a part of the way in which the Minister of Health and the Minister of Finance work to protect health going forward. So along with you, I'm looking very much forward to hearing from the lessons and experiences that are happening in some of the countries where we've been working, how civil society has partnered with government. Often people think that advocacy is just something that civil society does to agitate governments, but in fact, we like to think of ourselves as partners with government, helping them stay accountable, helping them to move the resources. So now, because of that close partnership, we have the honor this morning of meeting the newly named Minister of Health for Ghana. Please, Mr. Minister of Health, join us.
Good morning to you all. I bring you greetings from Ghana, Accra, Ghana, the center of the world. And from His Excellency, President Akufo-Addo. Myself, before I go to my speech, let me say that I'm actually the president of a civil society organization before I was named the minister. Public Health Alliance International, focusing on health advocacy and outcomes. And so I'm one of you. I'm actually one of you. So Excellencies, colleague ministers, distinguished ladies and gentlemen, I deem it a great honor to join you in this important event and to address this August event. Over the years, Ghana's health sector has seen rapid progress, evolving from large-scale investments having been made in infrastructure as well as services being delivered to residents. We have also expanded the routine vaccine platform from the initial 6 antigens childhood killer diseases to 11 vaccines as at the end of 2023, with its associated co-financing obligations. Despite the increasing willingness and commitment from governments to invest more in health, there is always the increasing demand and expectations from other critical sectors as well, amidst dwindling external resources as well as local revenues. This therefore calls for the active involvement of other stakeholders in the health sector, such as the civil society organizations, to continuously advocate and support governments to bridge existing gaps in health financing, especially of vaccines which have been considered as the most cost-effective public health intervention. This is rightly so, as it prevents the catastrophic cost associated with treating and caring for persons who become ill. It has been widely acknowledged that the engagement of civil society organizations in development and implementation of health programs can reinforce transparency, monitoring, public trust, and program delivery through uncorrupted resource mobilization mechanisms. This ultimately contributes to keeping governments on their toes in delivering on their mandates of ensuring healthy population through better healthcare delivery systems. In Ghana, vibrant civil society organizations do exist that have supported and advocated for the implementation of various critical health interventions. They are an integral part of public health emergency management and have supported awareness creation, monitoring, and policy advocacy for outbreaks and epidemic response. They have continuously advocated for an increased financial investment in the health sector, especially in terms of vaccine financing. And I must say, we are talking about health sector because this is a health sector program. But when you go to other sectors, civil society plays key roles, especially in gender and the marginalized. The civil society organizations in Ghana have also been at the forefront of the response to pandemics, such as COVID-19 pandemic, in different ways, including through service delivery, online education, fundraising, and mass immunization. Several CSOs in Ghana have formed a coalition under one umbrella to facilitate and amplify their advocacy and resource mobilization roles within the health sector delivery framework. The government of Ghana in recent times has relentlessly been making efforts to promptly honor its vaccine financing obligations for both traditional and co-financed antigens. It is noteworthy that CSOs have continuously engaged government to explore and advocate for ways of ensuring that funding for health commodities such as vaccines are promptly released to meet the co-financing obligations of the government within the context of graduation from Gavi support. These engagements have so far yielded positive results, such that vaccine stockouts have not been experienced for some time now within the immunization program. The active involvement of CSOs in ensuring that some health commodities that were stuck at the ports in recent times got promptly cleared with the support of leadership of the Ministry of Health is ample evidence of the crucial role that they can play. Recently, the government of Ghana brought together stakeholders to deliberate on the roadmap towards self-financing of immunization services in Ghana, and the CSOs actively participated in the entire process. Their active participation in the process that culminated into the development of a clear roadmap to ensure that Ghana efficiently manages the Gavi accelerated transition period and beyond, where adequate finances would be made readily available for vaccine procurement, is worthy of mention and emulation. Distinguished ladies and gentlemen, the CSOs in Ghana have periodically engaged relevant groups over the period to ensure that vaccine stockouts due to inadequate funding becomes a thing of the past. They have previously engaged parliamentary select committees on health. And let me say that I was a member of parliament and I was on the health committee, and we dealt with a lot of CSOs. Unfortunately, I lost my seat marginally and went out of parliament. And when I went out of parliament, I became a CSO myself. And I was called out of the CSO-ship to come to the ministry. So it's a healthy cycle. They have previously engaged parliamentary select committees on health and finance to advocate for the establishment of the vaccine fund, public health emergency and response fund. This is something we are pushing in Ghana with the support of CSOs. It is envisaged that proceeds from such funds, when established, could be used to support vaccine financing in Ghana and ensure sustainability when it comes to financing of vaccines. In addition, the CSOs contribute to the advocacy roles through the development of policy briefs, roundtable discussions, etc., where varied stakeholders such as public health specialists, immunization experts, members of academia, parliamentarians, journalists, community leaders, etc., meet to reaffirm their commitment to raising awareness of immunization financing as a matter of urgency. In Ghana, again, CSOs have been at the center of communal, regional, and national efforts to combat diseases, both communicable and lifestyle. Their crucial role in ensuring that government successfully delivers on its mandate of ensuring a healthy population remains critical, almost making them a healthy partner for the Ministry of Health. Their goal of raising awareness among stakeholders on the need for country ownership of the health of its own citizens by providing quality health services and increasing financing for these services in the face of dwindling external resources must be supported by all and sundry. In conclusion, I would like to thank all CSOs for their advocacy. I would like to urge them to continue because safety and security for the health of all citizens relies in the work of civil society organizations. I thank you for the attention and God bless you. Thank you very much.
Thank you so much, Honorable Minister, for those remarks. I just want to say it really warms my heart, A, that you yourself have been and continue to be part of a CSO, but also as an advocate, I know that when you meet an elected official in their first week, they tend to remember you. So I know I can come ask you for increased resources. So we move to our next government representative on our panel, the neighboring country to Ghana. We move to Nigeria, and we are so honored to have the Special Advisor on Health to the President of Nigeria, Dr. Salma Ibrahim Anas, with us here today. So I would request her to come on the stage. Thank you so much.
Thank you so much. The Honorable Minister of Health, my brother, I think you are still younger brother, Ghana to Nigeria, though we have a lot to learn from Ghana. So good to have you here, and congratulations. We are happy that civil society is now in charge of implementation. So you understand what I'm saying? Yes. So the team, the president, the vice president, and all your team, and those from Nigeria, distinguished ladies and gentlemen, a very good morning to you all. I'm very happy to be here, and I bring greetings from Nigeria, the president of Nigeria. President Bola Ahmed Tinubu is the new president. He assumed leadership. Today is 29th. Today is exactly 1 year of the new leadership in Nigeria under the renewed hope agenda of President Bola Ahmed Tinubu. And I'm happy to be discussing today the renewed hope health agenda of the president. Though we recognize a lot have been done in the past in Nigeria, there are lots of successes, but we still have a huge gap to cover. And because our desire, we're still committed to it, to achieve universal healthcare coverage, leaving no one behind, where all Nigerians will have access to quality healthcare services within their reach, at no cost for the vulnerable people and at affordable cost to those that can afford to pay for it. So I'm glad to be here, and I'm glad again to see a lot of people that have worked with us in the past, like Benjamin. I'm so glad to see you. He has been part of our success story in Nigeria. So aligning with the theme of this discussion today, the role of the civil society. Just like the Minister of Health in Ghana, I was also in the civil society, and I have been in and out of government. And I can tell you, Emmanuel can also tell you, that that makes a big difference when you come back to government, because you have the lens and the blood of civil society in you. So you do things differently. So I'm glad that I've passed through that journey, and civil society have been a critical partner in the overall health sector in Nigeria. And recently, they've played a very great role in health sector. So if I may just share a few success stories, You know, even in the establishment of the NCDC in Nigeria, the civil society played a great role. It was the collective voices of the civil society that made the government of Nigeria to create NCDC, the control of Center for the Control of Diseases in 2018. And the act was made that time. And then we're able from that time to have a budgetary allocation since 2019 till today. And the trend of the budgetary allocation has been increasing till today. Last year was about 3-point-something billion. Today it has gone beyond that to 4. So you can see a sustained increment. And that I can give the credit to the civil society because of the voices, the pressure that they have put on government. So when we are in government, we get them also to add pressure to government and say, please help us in addressing. And this is how we have worked with them in Nigeria. I'm glad to share also the commitment of the administration, which started in the last few years in trying to ensure that we have access to quality services for Nigerians. The government of Nigeria dedicates 1% of its consolidated revenue to provide services, to strengthen the primary healthcare facilities and purchase services through the National Health Insurance Scheme. We've gone to Ghana to learn how they are doing it. We felt they are much better than what we are doing, and we've seen a lot of lessons there about a few years ago. So this is what is happening currently, and we remained committed to that BHCF, and we are also requesting sub-national level because Nigeria is a country that operates an autonomous subnational government, and they have a huge responsibility to also commit and contribute to the basic healthcare fund, which is supposed to cover for all the needs of Nigerians. So this is to tell you the commitments that are ongoing, and this administration, going to the issue of accountability and governance, we've identified 8 priority areas, and the topmost of that priority area is on governance and accountability, because we still felt that we have huge gaps in the areas of effective accountability systems in the way we deliver healthcare services in Nigeria. An accountability framework is a critical component of it, and you will trust that it is the civil society organizations that are leading on that to ensure that Nigeria delivers and have a transparent and accountable system. Because even tracking the BHCF funding, civil society still plays a very critical role in it. But I want to mention here, as we partner with the civil society organizations, because we acknowledge their roles in governance, we acknowledge their role in identifying the key challenges that affect progress in the delivery of healthcare. We also acknowledge the big role that they play in tracking progress in terms of what we agree to deliver over a period of time. So in terms of monitoring and also implementation of programs. However, I would also like to reiterate the need also for civil society to be very knowledgeable about issues of governance, the processes of governance, especially governance financial regulations, the procurement systems of governance, because in most cases you find that there are huge gaps. And then because we are coming from different backgrounds, different countries, you find civil societies also have diverse approach in terms of holding government accountable. So if you are working in a country, it is very important that you become very conversant with the way that the government does its things. So for instance, when it comes to budgeting, they've played a key role in getting more support for dedication of resources and also commitment to co-financing of several projects, including the vaccine, the Gavi, including family planning. You know, it has been all the efforts of civil society pushing hard on government to reduce the counterpart funding for procurement of family planning commodities. However, when it comes to the processes, it's not so clear. So I'm urging that they need to understand also the budgeting system, the preparation for budget in government. How do we call for budget? How do we call for budgetary? And all civil society are part of it. And then what are the processes that it takes to get approval and also release of funds? And we also follow through up to the release, the point of release of the funds. But not also just the release of the funds, but the utilization of that funds for the intended purposes, because it could also be diverted. And one of the key crime in Nigeria is diversion of fund. Even if you are using it for another purpose that does not align with that objective, it's a big crime. So civil society needs also to understand those regulations that are put in place. and it will make it more comprehensive and more easy for us to partner together, and it could be better to hold government accountable for all the good intentions that we are doing, and also the errors that are being committed that hamper, that affects our progress in the implementation. So I will still want to request again that civil society should continue to use their voices as strong advocates, not only at the national level, because we're looking at what have we done, where do we have the major challenges in Nigeria, looking at the 8 priorities of Nigeria. In addition to governance issues, let me quickly mention some of them. One is to have a quality delivery of services through an integrated, comprehensive approach, tying together at the tertiary level, the secondary, and the primary healthcare level, which serves as the largest platform for delivery of healthcare services. So how do we make that to happen? Nigeria today is talking more about local production, local content. How do we produce our vaccines based on the lessons we've learned during the COVID pandemic? So we are now moving forward to create an enabling environment for manufacturers to attract the manufacturing companies to come to Nigeria, transfer technology, transfer skills for local production in Nigeria. And I'm glad to mention we are making some progress there. Local manufacturers are beginning to think of not even the manufacture of the drugs and other commodities, but also the big component of it, which is the active pharmaceutical ingredients. 100% is imported to Nigeria. We need to begin to produce with the raw materials that we have. And we are having a good collaboration with African CDC to see how we can achieve that. Today, they've already created a hub in Nigeria for Africa, and a regional hub for West Africa in Nigeria. So we want to attract all our brothers from the African continent to strengthen that. Let's start from there. We're looking at human resources is still a big issue in Nigeria. So how do we increase the quantity and the quality of human resources and also retain? At the same time, we are all witnesses to the migration, which we call the Japa syndrome. Nigerians migrate to all developed countries, and they do well there. Well, it's a win-win, but how do we ensure also that we scale a huge number in Nigeria that will deliver services? So these are some of the things we are pursuing. Partnership is a very important part of it, and civil society plays a very critical component of that partnership. And there are several other priority areas that we're talking about. Public health emergencies, which fits into the global health security, is a big component of our efforts. We've seen the devastating effect of COVID on Nigerians. And then we all know that Nigerians always have, how do I say, habitual epidemics almost every year, from diseases that should not be happening at this time, like cholera, measles outbreak still happens in Nigeria. Lassa fever is still a problem in Nigeria, plus additional new infections that are emerging. So it is very critical to us to strengthen the coordinating system, that is the National Control of Epidemics in Nigeria, the NCDC at the national level, but most importantly at the subnational level, so that they will be able to prevent. More focus is now on prevention of diseases, ill health in general, promotion of health, and provision of services. How do we play that role more at the subnational levels, and also get a strength with capacities developed at subnational level to be able to detect, early detection and good surveillance systems instituted in our system, and to be able to prevent diseases. So these are areas we are extending and inviting more civil society partnership to achieve successes in that direction and to build capacities at that level. So I will not talk too much. I think I'm supposed to speak for only 5 minutes. Let me stop here, and then we can speak more during the panel discussion. Thank you so much, and I'm happy to be here.
So thank you so much, Dr. Salma, for those remarks. I want to say that I had the pleasure of meeting Dr. Salma last year when she was just newly appointed at the UNGA. So clearly that theory that they remember you if you meet them early on and make an impression I have to really acknowledge that when I sent a request to Dr. Salma to participate in our panel, she actually confirmed within 24 hours, which really is amazing, her commitment to civil society. So thank you so much for your leadership. And it's so, such an honor that we have, obviously two members of, distinguished leaders of government, but clearly their heart is with civil society. So moving along, when you talk about the picture of health financing, obviously our emphasis is on domestic resource mobilization, but obviously multilaterals play a very big role in the health financing picture in the low and middle income countries. So we are really, honored that we are joined here by Dr. Benjamin Levinson, who's the director of the Immunization Financing and Sustainability team at Gavi. And for GHI, I just want to thank Benjamin, because we at GHI started a partnership 16 months ago with Gavi, actually leading domestic resource mobilization for immunization financing in 10 countries. And it's been an incredible journey of learning and sharing. So Benjamin.
Good morning, friends and colleagues. And as my Nigerian friends say, all protocols duly observed. Otherwise, we could be here for a while. I work at Gavi, and we're looking ahead now to our Gavi 6.0, which is from 2026 to 2030. And what we're looking at is at a 50% overall increase in co-financing, meaning the amount of money that countries themselves have to pay to obtain Gavi-supported vaccines. That sounds like a large increase, and partly it reflects the introduction of blockbuster vaccines like malaria and human papillomavirus, HPV. So this is great. I mean, what we're doing is saving kids, saving women from cervical cancer. But the cost is high. There's no question about it. And it seems to me that part of the challenge really needs to be met by civil society and what they can do in terms of budget advocacy. I think there are really two voices that are often missing from discussions of health financing. One is the voice of the poor, and ironically, the other voice that's often missing is the voice of the Ministry of Health. Let me talk about those in sequence. When you do surveys in the community about what poor people want from their government, they typically, you always get the same answer. Poor people want three things. They want economic opportunities, first. They want education for their children, second. Third, they want good health services. It's always the same. You can go anywhere on this planet, and poor people want the same things. So the question really is sort of, if clearly that's what poor people want, why are our government budgets so askew? There was the Abuja Declaration in 2001, which committed governments to spend 15% of their budgets on health. How many countries in Africa currently meet that threshold? 2, Capo Verde and South Africa. And the other countries aren't even close. So it's really difficult to see how the priorities of poor people are really being reflected in government. This is something that needs to be corrected, and I think civil society could play a big role in this. So the second part is about the voice of the Ministry of Health. You'd think that they would have a huge voice in cabinet. And with rare exception, and I may be looking at those exceptions, the voice of the Ministry of Health is often very, very weak. I have a colleague at Gavi who was given a plaque by a Ministry of Health, shall remain anonymous. And I heard about this, and I said, congratulations, that's really enticing. What did you get the plaque for? She said, well, I introduced my Ministry of Health colleagues to the Ministry of Finance colleagues. And I didn't know whether to laugh or cry. I mean, I really, really? These people don't know each other. It's a real problem. It's a real problem. And then I was in another country last year, and also shall remain anonymous, and they just forgotten to put their co-financing obligations into their budget request. And then we went to see the Secretary of Finance, and the Secretary of Finance, very able gentleman, young, 35, 36, something like that, and he was livid. He was almost screaming at these people. You could see my Ministry of Health colleagues. I mean, they were almost shaking. He said, first of all, how can I take you seriously if you don't put in your budget request the money that you need for co-financing? Worse, you have $6 million that are sitting with me waiting to be released, but I need a request from you. I cannot send you money without your requesting it. That's how it works. And there was $6 million waiting to be released, for primary health care, and they were just sitting unused. So I think really, when it comes to the Ministry of Health, they need lots of friends, because right now they don't have much influence. And part of the friends that they need is civil society. They need friends among the donor community, even the IMF. The IMF has changed, and they too now really care about social sector spending. I think it's really important for ministries of health to have a big tent and welcome in anybody who can be helpful to them. And I think civil society has a clear role to play. Just lastly, I'd like to talk a little bit about my experience working with civil society and some of the lessons I've seen. The first thing I've noticed is that whenever people engage with civil society at country level, it tends to be itty-bitty contracts, $20,000, $30,000, and it tends to be for 1 year. And I don't think that's a very serious effort at doing advocacy. I don't think that's the kind of money that it takes to actually launch a serious campaign. It's not that you need huge sums of money, but you do need more than $20,000 or $30,000 a year. And you need to know that that money is going to be available for a few years. It's not, you don't make progress in a year or two. So it's that combination of having, one, people who know what they're doing, two, a serious commitment of resources, and three, the time to actually make a difference. If those things are in place, I think that we could see huge increases in domestic resource mobilization. Look, I lived in Nigeria for 5 years. I worked on Nigeria for 10 years. The government of Nigeria spends roughly $3 billion a year on health services. That dwarfs, what it gets from an official development assistance. If we make a 2% increase in that amount, 2% shouldn't be hard to achieve. That's $60 million every year. It's a gift that keeps on giving. So if we can make a difference to the allocation, I think that has repercussions, that will be very happy, which will include, making sure that Nigerian children get malaria vaccine and Nigerian adolescents get HPV. I think civil society has a clear role to play. It's not just civil society. The ministries of health really need to take advantage of all their friends, including civil society and others. Thanks very much.
Thank you so much, Benjamin. So now we move to the civil society part of our panel, but I can see everyone is a civil society member in heart and in reality. So we will now hear from Cecilia Sanu. She is the Executive Director of Hope for Future Generations in Ghana, a civil society organization that has been working for the last 2 decades across the breadth of Ghana on a range of issues. She is also leading the budget advocacy campaign for immunization financing and will tell you her journey about both sort of securing the co-financing in the last year, but also her efforts on accountability. Thank you.
Good morning, colleagues and everybody, and all protocols observed. Nigeria is our neighbor, so I'm now a Nigerian. Thank you very much. I'm very delighted to be talking on behalf of civil society on the advocacy for accountability mechanism for sustainable health financing. So we are very happy to be part of this. We are civil society, and we have been, and we will be civil society organizations. Yeah, so I want to say that one success I want to talk about is trust with government as we do our work. The second thing is mapping the right people to work with you. The third one is investing in capacity of civil society to be able to do the work that we're supposed to do. And every civil society organization is very passionate about the work that we do. We are so delighted. Starting the project in Ghana wasn't easy, but with a great support of Guy, we have really made 1 year a success. So we started this discussion. We map up the right people, UNICEF, WHO, and all the partners that are in immunization. That was what really helped us, including Ghana Health Service and Ministry of Health. The doors were open, and they continue to be our champions. I want to say that the parliamentarians are very important when we are talking about advocacy, especially financing. So what did we do different in Ghana? We partnered, we gave a lot of information to the parliamentarians, looking at the gaps that we have. And now, not only at one side, the health part, and then the those who are the finance parts, and we gave them a lot of information, policy brief. We monitored and came out with the gaps from 2022, looking at how Ghana has invested its own resources into immunization. And so we were able to convince the parliamentarians that, look, these are children that we have. In your home, in your family, you have children. We were also children. And so if we don't invest in our children today, what will happen? We need to create that future. They were very happy, and all of them really pledged their support. And from that time, the parliamentarians become our champions. At different level of the advocacy, they let us know what is happening and where to go. They gave us the contact of people we should call, and we have champions in Ministry of Health. We have champions in Ministry of Health. We have champions in Ghana Health Service. And one of the directors at Ghana Health, he said, look, Cecilia, what you people are doing, you are helping us to do what we are supposed to do because we are unable to advocate for resources. But you are civil society. You can say anything and nothing will happen, so continue. So we get the information from them. Another thing that we continue to do in this project was to use social accountability tool. So looking at that, we try to monitor, we utilize the social accountability tool to facilitate information gathering, not just from national, but from the grassroots, which was very important. That's community-based monitoring and feedback, because we use these people and gather all the evidence that gave us the opportunity to show to the people, the policymakers, that look, this is the gap that we have identified. And it is the mothers, it's the queen mothers in all these people who have gotten this. And so the community were all involved to know that it is important to really do what we are doing. I would like to say that queen mothers in Ghana, we call them queen mothers. These are mothers who are in charge of the communities. They are queen. They are role model to women. They are role model to girls. And their voice is government, the president, everybody give them that special respect. And so we mobilized the queen mothers. We made sure that they had all the information. And you know, these queen mothers, most of them have families, they have children, they have their wives, and their voices are very, very important when it comes to health. And so these queen mothers led the advocacy. We just empowered them with all the information. So whatever is happening, wherever you want them to go, they say it. And I think the queen mothers play a very critical role. They are very sustainable because queen mothers in Ghana, until you die, you are forever there. And we use them as our sustainable strategy, because you can get a queen mother for 30 years, she's still a queen mother in the community. And just imagine 30 years, you still continue investing in someone's capacity to support your program. So Hope for Future Generation use queen mothers to make a lot of impact in our program that we work on. We have also mobilized civil society, not just civil society. We brought civil society from different levels. So the civil society, we brought them from health sector, from academia, from the private sector, and we also gave them the opportunity to understand. So mobilizing all these people into the program have really helped us. I really want to recognize guys' capacity investment in civil society. If you want civil society to continue supporting, I think it is time to invest adequately in the capacity of civil society organizations to support what we're supposed to do, and also in partnership. I just want to share this briefly, and we are happy to continue this work. And this is what I want to share on behalf of my team from Ghana and everybody who supports us. Thank you very much.
Thank you so much, Cecilia. So we're going to take a big leap over to Asia and hear from our GHAI colleague who actually leads our Vietnam office. And she works on a range of issues, and budget advocacy on all of them, including tobacco control, drowning prevention, civil registration systems. So please join me in welcoming Huen.
Thank you, Vandana, and it's my very great pleasure to be here and to have the case from Vietnam. I want to talk about the very unique program we are launching in Vietnam over the last 5 years. That is a child drowning prevention program. Early 2018, the program started. You may know that drowning is a leading cause of death among children under 15 in Vietnam. So it means that every year, more than 2,000 families lost their life due to drowning. And I have been chanced to visit their home and share the condolence with the family. I found that it's very invisible, painful, but it's very, very lack of sorry when they don't have any support or funding after their child gone. There's a very big question from my mind and our team. When we start the intervention in Vietnam 5 years ago, there's a lot of question. How to bring the best practice of the global from WHO guideline to Vietnam in the very specific population in the specific time with the geographic region, and there's a lot of things different. And at that time, we are focused on the survival stream and the water safety education for the children at the age of 6 to 15 years old. We do not select the big city with a very good infrastructure. We are targeting to the highest burden of province, and almost most of them are located in the mountainous and very poor area. And now, over the last 5 years, the rate of drowning has been respectively reduced 30%. It's much higher than the national target. And moreover, in our intervention program, the rate of children who can swim already 3 times higher than before intervention. But I think that the most successful story is that we are advocating successfully to raising the support from the government at the national and the local level. But moreover, we have been seeing that the funding for the child drowning prevention program has been 5 times increased before intervention. There's many poor provinces, they pay money from the state budget to build the swimming pool to support for the family who lost their life and who do a lot of the intervention to to fill the gap in the high-risk environment. So what is the lesson learned I can share to you? I also learned a lot from our excellencies and from the great speaker and panelists, but I want to focus the 3 lessons learned I have been witnessed from Vietnam. The firstly, every single public health program is a very multi-dimensional approach and need to be very comprehensively. Before intervention, we always think about how to make the program sustain when it ends. Not only how to make it start, but what happened when it ends. So think about the sustainability, the program ownership, and the funding for the program. And I think that the connection among the CSO and the government are very different among the global, among the region and every country. It depends on how we approach the program. I think that sometimes the CSO should be very patient with the very long journey of the public health program. And moreover, the CSO need to partner with the government at the local and the national level to have a very clearly define the political situation, the mapping of stakeholders. There are a lot of work for planning and intervention to be sure that our program cannot be standalone. It needs to be integrated into the long-term plan and the policy of the nation. In Vietnam, the child drowning prevention program integrated very consistently with the child injury prevention of the national ratified by the Prime Minister, and we include our surveillance system into the implementation of child rights. And when the United Nations Commission for the Implementation of Child Rights, they talk about and they measure the implementation of child drowning prevention. So it means that our program is very solid integrated into the national program of the nation. And secondly, I think that the evidence very always important. We also working with the think tanks to have to develop the cost norm of every single child who can learn to survive and swim. And when we know the very concrete and consistent data, we advocate to the government, hey, look, that is $30 to save life of every single children from drowning. How you can pay for that? From which source of funding? Which is the funding not only from the government cannot pay for anything, but the private sector and another stakeholder in the community can pay. And in my country, the parent association are happy to pay 50% for the child drowning prevention cost. And when we are very strong, evident with the very concrete data, we can advocate with very transparency, very clearly message to the government. And lastly, but I think that it's very important that the CSO and the government agency need to be work together. At the early stage of implementation, they need to be a very clear statement about what they are and how the end goal. The common value should be set at the early stage to be sure that, yes, why we are here, why we need to work together for the same purpose, and what is the ending goal we need to be achieved. So I think that the clear information, the working mechanism, and how to be shared, how to be learn each other are always important in every single step of the program implementation. So thank you so much for your listening and happy to be here. Thank you.
Thank you so much, Huen, for sharing. Vietnam is now the leading drowning prevention program in the world. And a lot of it is really commendable because it's truly a civil society and government partnership. So last but not least, I want to invite Emmanuel Al-Hassan. He is both the Deputy Director of our immunization team and leads our programs in Nigeria, which are on immunization and prevent epidemics. But I also want to say that he is a great sort of speaker to close out the panel because he is also one of the key authors of our budget accountability and budget advocacy framework, where he has focused a lot of his work on the theme on which we are talking about today, How do we make sure that, spending on budgets is accountable and sustainable and transparent so that the dollar is, every dollar is reaching to the last mile? So Emmanuel?
Thank you very much, Vandana. Good morning, everyone. It doesn't matter which sector within which you operate. It doesn't matter at what level, whether it's national, regional, or local. Accountability is very key. So for instance, when I worked in the corporate sector with the O&O PLC, if you diverted fuel or gas, as they call it in America, that was meant for a particular filling station or petrol station to another one, you got fired. If you misappropriated funds, you got fired. It was as simple as that, because if you don't get fired, then others are going to do it, and it's going to impact on the bottom line. It's also going to impact on the image of the organization. In government, I realized early on, having served as a director with a national agency for the control of AIDS, that it is in everyone's interest to actually partner with civil society. Dr. Salma will tell you, when she was Director of Public Health and other positions she has held at the federal level in Nigeria, and also as Honorable Commissioner for Health in Borno State, she will tell you that if she wanted something done, if she had a request for maybe the minister or maybe another ministry or Mr. President, there's an extent to which she can go. Certainly, if you're a director in the Ministry of Health or in any of the government parastatals, you cannot carry any placard. You actually need the civil society to make the case for you. So we have been working in Nigeria, the Global Health Advocacy Incubator, at all levels to advocate for increases in budget for epidemic preparedness, health security in general, and more recently, immunization and strengthening of the primary healthcare systems. And we are very happy to announce that there have been great successes. For instance, within 3 years, working with various groups, coalitions, civil society groups, government officials, working with even community leaders, traditional leaders, religious leaders, we've been able to experience a twofold increase in the budget for NCDC. We've been able to work in Kano State, which is at the subnational level, where a brand new budget line for EPR, Epidemic Preparedness and Response, was created and funded. Very happy to also announce that in Lagos State, we're able to work with the Civil Society Coalition in Lagos and with other partners to ensure that a brand new budget line called Public Health Emergency was created and funded and is still being funded. We are very happy also to have worked with all the stakeholders, and this time, led by NCDC, to have to develop what we call the Health Security Accountability Framework. We are in the final stages of that. Only 2 weeks ago, we met with the new DG of NCDC, and we're going to have some validation, and hopefully, sometime soon, we'll be able to share that. And the reason for that is that we all need to hold ourselves accountable. And it was instructive that during the Gavi Partners meeting in December, the Director General of the Nigerian Primary Healthcare Development Agency, Dr. Aina, actually talked about mutual accountability and the need for everyone, not just civil society, but government and every player in the health sector to hold ourselves mutually accountable. And the only way we can do this is to jointly agree on mechanisms to ensure that we can all hold ourselves accountable. And so, for instance, the Health Security Accountability Framework looks at not just what is budgeted, but what is released, and then how is the money spent. And GHI has worked with all our stakeholders in country working with, in fact, for the first time in Nigeria, we're able to bring the focal points on health security and the budget drafters of all the NAPS MDAs, the National Action Plan for Health Security, players, all the ministries, departments, and agencies involved. Because a lot of times the health people are always talking only to themselves, but we're able to bring together the budget drafters, people in the departments of accounts and finance of these various ministries, along with the focal points together to look at their respective roles, under the One Health, approach, to look at their respective roles and to help them to actually craft activities for their respective MDAs. And for the first time, 2-3 years ago, we started having budgets, for instance, on health security for the Ministry of Environment, for the first time for the Office of the National Security Advisor, and all the other MDAs, that are part of that NAPS infrastructure. And so moving forward, then there's the advocacy for the release. Again, there are accountability issues around pushing for releases. And then the last mile, how is the money spent? Which is where really we still have a long way to go. And I think that today's gathering gives us an opportunity to have a dialogue between all the different players in this room on how civil society needs to understand how to approach the issues around accountability and how to work with government, how to do the advocacy, how to partner with government, and how to get them to understand the need to be part and parcel, of this whole conversation and the actions that are necessary to ensure that we all hold ourselves accountable. Gone are the days where just picketing and carrying placards will solve issues. Gone are the days when, putting the effigy of maybe the Minister of Health in a coffin and all of that will yield, the kind of results that we would like to see. We are happy to say that GHEI has really, over the years, gotten the experience, understanding the local context, understanding the nuances of engaging with different stakeholders, to produce the necessary results. I do hope that at the end of this conversation, we will all leave here with a little bit of a better understanding of the things that we need to do to ensure that we enhance accountability in our health systems in our respective countries. Thank you so very much for coming.
Thank you so much, Emmanuel. So now I'd like to just open up the floor for questions. So please raise your hand if you have a question. Yes. Is there a microphone? Yeah. I think he's...
Thank you very much. And Emmanuel, we worked very closely with Emmanuel. My name is Patrick Nguku. I'm with the African Field Epidemiology Network. We build capacity for epidemiologists. So my question is, yesterday we were involved in a discussion on priority setting and resource allocation. And there was the issue about providing evidence for setting priorities for public health needs in Africa. And just how does the advocacy piece then get into the evidence generation for policy and practice influence? How do we tie up the efforts by African CDC in setting up evidence-based priority settings in public health with this advocacy work to influence resource allocation?
Thank you so much. So would one of the government representatives, Honorable Minister, would you like to answer his question?
Thank you very much. I think when you have a situation where governments sometimes complain about scarcity of resources in implementing programs or co-financing programs. You should not be too surprised if you don't have resources going into research to get the data which you need to make advocacy. And so it is refreshing and good news when you have data worked on sometimes by regional bodies like CDC, Africa CDC. The least we can do is to use those data to make the advocacy or to make the case. And when I said we should use, I'm speaking about both the voices within the Ministry of Health, allies of the Ministry of Health, including civil society or mainly civil society. And this advocacy is usually directed at central government, as in the cabinet, where other sectors try to fight for the resources that are on the table. Key amongst these, influential people that we need to speak to is the finance ministry. And I agree with what our senior colleague said, that there must be a healthy relationship between the health ministry and the finance ministry. In fact, it must be a very good one. And in countries where the Minister of Finance is a health advocate, life is usually cool. Life is very, very cool. You struggle at places where the Minister of Finance is not a health advocate or does not prioritize health as much as other jurisdictions have. And it's even worse when the two ministers have issues in the past. Sometimes the politics of relationships can even have an impact on a whole sector. And so in Ghana, for example, everywhere I have been a board chair of the biggest hospital in Ghana. I've also served as the Chief Executive Officer for the National Health Insurance Scheme, which is the main body that pays for most of the activities of health in the country. And one of the lessons, and I was also on the Health Committee of Parliament, and one of the lessons I picked was that your best friends, if you are into health advocacy, should be the MPs who do the allocation in Parliament, and the finance minister who is supposed to disburse the funds. And I think the more time you spend with them with data, the more they appreciate your concerns. And sometimes even field visits. Recently, we had a health summit in Ghana just a few weeks ago. And my chief director asked me, who do you want to come as a special guest of honor? Choose between the chief of staff, possibly president and a finance minister. And I said, talk to the finance minister to come. So he was a special guest of honor. So the more we relate, the more likely we are going to get the resources to push those outcomes that we are looking for.
Thank you for that very comprehensive answer. Do we have another question? Yeah.
Good morning, everyone. My name is Alan Maleche, and thanks to the panelists. I work for an NGO in Kenya called Kelin, but I also sit on the Global Fund Board with Cecilia. I think my question to all the panelists is, we speak a lot on raising domestic resources, but we frequently don't speak about proactively addressing leakage, wastage, and corruption. I've read a number of Global Fund reports where I see countries return money because they're not able to spend it. I have seen in my country the Ministry of Health returning money and they've not been able to spend it. So are there proactive ways, both from a civil society perspective, private sector, government, that we can proactively deal with leakage, wastage, and corruption, not to catch it at the tail end, but to try and prevent it so that whatever resources we get from donors, whatever resources they get from us as taxpayers, actually does what it needs to do, and maybe then we will have more resources available domestically. Thank you.
Thank you so much for that question. That is really the sort of the heart of our conversation today. Dr. Salma, would you like to maybe answer that?
Yeah, thank you so much for bringing that up, because the worst that can happen to a country in need, like most of our countries, is to have resources that you cannot spend and you return the resources. And we see that happens a lot, not only with Global Fund resources, but even government resources. Not only Kenya, even Nigeria, we've witnessed that, where Federal Ministry of Health will have to return money because of non-absorption of that funds. And they tag it as absorptive capacity issues. So I'm happy you mentioned that. I think it's much more beyond absorptive capacities in terms of capacities that are available, but also it's in terms of the processes that are involved. And I believe the processes are there. That was why Global Fund situated the Global Fund implementation within the health sectors, governance sectors, to strengthen the systems. Part of it is to strengthen the systems, to strengthen the way we do things, and also to strengthen our procurement processes in the system. But you find that if we cannot, because of also the corruption, the interests that are there, then that funds are not utilized, and then donor funds are returned. So this administration under President Bola Ahmed Tinubu, as I mentioned earlier, under governance and accountability, the issue of good governance within the health system is very critical and very important. And it's identified as one of the key bottlenecks to delivery of healthcare. In fact, worst at the subnational level, where the accountability systems are very weak. So what we have tried to put in place is to strengthen that systems of governance. And also, while we're doing the prioritization, civil society were part of it in all the processes that happen. And I also want to encourage civil societies to be more proactive. You know, you have to be unique and stand and be of people of integrity, because part of your role is to track progress, is to track accountability, and ensures that monies dedicated there are utilized for the intended purposes. We already have a system in Nigeria, the bill that allows you to speak. You know, media are part of it. Flag it up. We have the whistleblowers. You have that responsibility as a whistleblower. Blow it out. We have the EFCC, but EFCC will not come and start hunting for corrupt people or thieves. But they want to have an alarm. If you raise the alarm, someone has to raise an alarm. So they are not getting it from the health sectors. And this is what they keep on telling us. We are not getting alarm from the health sectors. And I feel that should be a critical role of the civil societies, to raise alarm in a very constructive manner that will add value to track progress, so that we can utilize these resources. For me, I always say it's so bad that we return money while women and children are still dying, and the funds are there being returned. We return fund for nutrition. Because of underutilization, we have to go to World Bank and start negotiating again for extension. By the time we extend, just consider the number of women and children that are dying from malnutrition in the country. So I think it's doable, and we need to do more with civil society to achieve that.
So I want to actually also turn this question over to Benjamin, because accountability is not just important for domestic resources, but very critically important for multilateral resources. So perhaps from a Gavi fund perspective,
So thanks for that, and it's a really important question. I think there are two sides to this coin. I mean, one is sort of whether money is used appropriately, and that's a really difficult thing. I've done this my whole career, and I don't have a secret weapon here. I don't know what the answer is. I think it's just hard work and persistence, and it's difficult. I would suggest that decentralizing money all the way down to health facilities is one way of increasing accountability. At the facility level, if you engage with the community, people can see what's going on, and you can tell whether money is being used appropriately. But the other side of the coin from the use of the funds is what's actually achieved. And I think this is where civil society can really play a key role, is that holding governments to account for the results that they achieve is really an important function. Because just many of the ministries of health that I've worked with, they get good results, they get bad results. It doesn't really affect them. It doesn't hurt them. It's not a career-limiting move to get poor results. And that's why I think civil society can play a key role in increasing the pressure on governments to perform. I think that's particularly useful at the local level, where It's individual health workers who know the people that they're dealing with, and they want to be accountable too. They want to do a good job. Let's make it easy for them. So I think you need to look both at how money is used, but also with the results. So we insist on proper accounting for the money, and I completely agree with that, of course. We are less stringent when it comes to measuring the results, unfortunately, and I think that should be part of it. Our friends from Ghana have achieved remarkable success in primary health care. They don't need to be accountable for results. That just becomes an issue of what happens to the money. In Nigeria, it's both. It's both the money and the results. Thanks.
Thank you so much. Other questions? Yeah, we have a question.
Right, thank you very much. My name is Labran Musa from Ghana. Of course, also working with the Ghana NCD Alliance, and then also with the Vision for the Development. Right, so indeed, I agree on the fact that there's a strong link, between the Ministry of Health and Ministry of Finance. And I am talking from experience. I remember when we were advocating for the excise duty amendment bill, for instance, or I'm talking about the excise taxes on tobacco, alcohol, and SSBs. In fact, it was practically very difficult, to get the Ministry of Health to be part of the process, practically because it has to do with finance. So we're dealing mainly with the Ministry of Finance, to achieve, the success. So the point for me is, and in fact, even when we went to Parliament, it was difficult to get some members of Parliament to understand and I appreciate the fact that we need excise taxes on these products just to be able to use to finance our health sector. So, but of course, I'm also happy to hear that the Ministry of Finance was the special guest of honor at the Health Summit. And indeed, I also heard that the Chief Director made a very remarkable statement on the fact that the ministry will look at how we could earmark, some of the funding that we are getting for the excise taxes, to finance health. And I'll be happy, to also hear my minister also re-echo this. Now, and then finally, let me also say that indeed, we need to reorient the way and manner we put our delegation together to meetings like these ones. Because I attended a couple of meetings, and most of them, you'll find out on NCDs and financing. NCD and financing, but what is NCD and financing if the Ministry of Finance is nowhere in these meetings? I've attended a couple of meetings, including WHO meetings, where there are technical issues on financing, but the delegation normally comes from the Ministry of Health, and practically you don't find any technical person from the Ministry of Finance. So I think that we need to begin to look at the delegation that goes to such meetings, and then include the ministry. Once they are there with us, they understand the issues, obviously they'll pick it up. And then appreciate the fact that we need to prioritize health, not only looking at finance and looking at health, on another side. Thank you very much.
Thank you so much for that question, because I think we obviously had a lot of questions and discussion related to communicable disease. And I think you sort of talk about raising taxes on SSB and tobacco, something that GHI, and our sort of parent organization, CTF, Campaign for Tobacco-Free Kids, works on. In fact, my Bangladesh example of taking 2 years to increase get the surcharge approved and 7 years to get it actually utilized comes from a tobacco surcharge to be used for health promotion. So I'm going to turn to the Honorable Minister if he has any thoughts about sort of getting, tax money, on sin products like tobacco SSB allocated for NCD health promotion and making those linkages.
I think I'm happy that my brother mentioned the chief director for the ministry as having hinted that work could be done to get some allocated. It's safer to have him saying that for now, because of where I sit. Once I speak about it, it becomes more or less policy. So I think all I can say is that we will work hard to get as much as possible for the sector from all sources, especially sources that bear our name or come from us. For example, when you take, we had a levy introduced and when COVID struck, called the COVID-19 levy, although it was meant to help raise revenue to handle some of the challenges that come with COVID. And I think we all are aware that the challenges are not in code health. There are economic ramifications of COVID. There are people with medium to small jobs who suffered because of COVID, and all the support that you need to give all these sectors, which ultimately will translate into determinants for health, improved outcomes, were meant to come from this levy. But now that WHO has declared the pandemic being over, of course, we have some cases. It's more or less an endemic condition now that you can pick every now and then, but it's no more a pandemic. We have groups, again, civil society, other interest groups, pushing that this COVID levy should be allocated completely to health. It came from a pandemic. The label is that of a how do you call it? A disease condition. And even if it's gone and we are still charging the levy, it should come to us. I believe strongly that if the argument continues, I will not be surprised that in the near future, some of it, if not all of it, would come to the health sector to be used to address issues like you are asking. So these are, who said so? I think one of the panelists said, the civil servant, yes, Madam Cecilia said, one director told her, you continue to make the noise, we can't make it. And where I sit, I would engage my colleagues to make that argument. But in terms of open advocacy, the political correctness is not there. But I will urge my colleagues in civil society not to die down on some of these comments. Ultimately, we are likely to get more resources. Thank you.
Thank you so much. I'm actually going to ask Huen, our colleague from Vietnam, where we have a very successful example of using tobacco tax resources to fund health promotion, to just briefly talk about that.
Thank you so much for a very great question. I want to make the example for Vietnam Tobacco Control Fund. Before 2012, the state budget for tobacco control in Vietnam is $2,500 per year. They only allowed to pay for like the communication activity in responding to the World No Tobacco Day. That's it. But now, 10 years later, gone, and the budget annually for Vietnam Tobacco Control Fund is $12 million per year. Because when we advocate to develop the first ever tobacco control law, we developed one separate article about the establishment of tobacco control fund. And that is the compulsory collection for the industry, 2% of the pre-factory price allocated for the fund. And now the fund managed by the Ministry of Health, but under the regulation, financing regulation and supervision of the Ministry of Finance. So I think that the Vietnam Tobacco Control Fund is a very great example about the connection, the marriage among the Ministry of Health and the Ministry of Finance. They always set up the common goal. They know that, oh, that is great for sustainability, and then the government don't have to pay tax from the state budgets for tobacco control fund, but the industry need to pay for that. So I think that we can learn a lot from the health promotion fund and how to use up the not only the state budgets but other resources for the sustainability of the program. Yeah.
Thank you so much, Huen. So I know there are a lot of other questions, but we will have to draw this really interesting panel to a close, and we hope we can continue the conversation. I think the speakers, many of them will be able to stay on and continue this conversation with you. So in closing, I just want to say that I think, as we've heard sort of some key themes from all of our panelists, but also in the Q&A, that, in some ways money allocated does not result in money being spent, or rather well spent, and service delivered to those who are most in need. So I think that, just getting resource allocations, whether from the Global Fund or Gavi, but more importantly from your domestic governments, is just in some ways the beginning of sort of the journey of budget advocacy. I think the work for civil society, as a watchdog, as someone who keeps, vigilant, raises the bell, rings the bell, blows the whistle, to quote Dr. Salma, that continues and becomes even more important when there's money at stake. You need to make sure that the money is well spent. I encourage all of you, we have a lot of resources on our website, budgetadvocacy.org. I want to make a shout out to Amanda McClellan from Resolve to Save Lives, who's been an incredible partner in our journey of developing a lot of these tools, which were developed through our Prevent Epidemics program. And we're now actually customizing a lot of these tools to be applicable with specific tools on immunization advocacy. We actually have tools on, tobacco control that we're going to launch, as well as on primary healthcare and other issues. So I encourage you, because there's both the framework, a toolkit, a facilitator's guide on how you can do a train the trainer training. We've just recently launched a CSO Academy for budget advocacy on health security in partnership with Resolve to Save Lives. Because, obviously we'd like to give large grants, as Benjamin talks about, but, resources are limited. So we really want to be able to, share the knowledge and the learnings, with a really large group. And I just want to share, there was such a high demand. We had 7 slots for this CSO Academy that was Africa-wide, and we got 169 applications for this hybrid academy we've just launched. So, I want to say there's a lot of interest in this issue, because this issue is critical to making sure that those who are most in need get the services. So I just want to, again, thank, this very distinguished panel, our government representatives who've taken their time. And, obviously they've come here both as sort of representing their governments, but clearly they also had their civil society hat on. I want to thank Benjamin, and then obviously all our colleagues from the civil society panel. And most of all, thank you all for taking this time. I know you probably had 10 options to juggle, so thank you for choosing us. And please continue the conversation. And there's food still outside.